Grace is never measured in excess. Its strength always comes when you're at your weakest. Not when you think you're at your weakest, but when you truly are. So be strong in the faith you have, and the rest will be added to you. It will be just enough. So March 31st, my father was living with us. It was a Tuesday morning. Keith woke me up. He had been outside and taking care of the horses, feeding them like he always did. And he came in and he said that, he said, you need to call my office manager and let her know that I can't come to work. That he says, I'm going to have to go be seen. He said, I'm just feeling really short of breath. In the meantime, my father, we had to have him checked because he was continuing to run fevers. The next day, Keith calls me very upset, saying that his heart rate is up, his oxygen levels are down, and he thinks they're going to have to put him on the ventilator. I got off the phone with him after an hour of talking to him. And then next thing I knew, I get a phone call from the doctor at urgent care saying my father had to be admitted to the hospital. So I had to tell my 101-year-old father that he was going to be admitted and that I couldn't be with him.
When I met Keith Fox and Mr. Means, it was April. I remember just being struck by it because I knew that the father was a decorated veteran and that his son-in-law was in our ICU as well, and they had a very intense connection, and you could feel that.
Thinking back, he was probably one of the first really sick patients that we had from COVID-19, and you know, we're still learning a lot about the disease now. We were definitely learning about the disease then, and you know, I think we all put a lot of time and effort into trying to get Keith better and give him the best opportunity to succeed.
We really had nothing available specific for COVID at that time. A lot of the things we were doing then that are the standard of care are no longer used. And so there was a lot of fear of the unknown.
I was calling up there twice a day. Once speaking to the nurse taking care of my dad, and then I'd get on the phone with the nurse taking care of my husband. And I did that every day.
I remember wondering what the wife/daughter was going through and the intense emotions she was having.
The staff actually wheeled him down to see my dad, which I know helped both of them tremendously. And that's something I'm so very grateful for them to do that. But I got to FaceTime him. I FaceTimed with Keith while he was in the room with my dad. Monday morning, Dr. Keith called me and said that they had to put Keith back on the ventilator. And then 10 o'clock that morning, I got a phone call saying my dad had taken a turn for the worse and had had a stroke. So we got to go up there, my sister and I, to see my dad. And Dr. Day took me down so I could spend some time with Keith.
The end of the world at the palm of my hand. When it all goes to hell, will you still be my friend? My face to the sea and my back's to the land. And if you can't come with me, I'll understand.
Donna and her father have a very deep connection, and it truly is, she's daddy's little girl, and I can relate to that because my dad is my best friend. The day that Mr. Means passed away, I played music. His favorite music was big band. The song that was playing was You'll Always Be My Daddy, and that to me just signifies so much, and that Mr. Means was present with us and was always going to be present with Donna.
Cause when you travel light, some things are left behind.
The day that Keith passed away, when they called us up there, Dr. Day and Dr. Choi and Dr. Keith were there. And all three of them were in the room. Dr. Keith was sitting there next to me, and Dr. Day and Dr. Choi were standing at the foot of the bed and had tears in their eyes. I think they just wanted so badly for him to beat this.
That was a very emotional day, and as a team, we had poured a lot of effort into Keith and become close to he and his wife. And when I got that phone call, I felt that it was that I needed to be there and be with him and his wife and their son and daughter-in-law, at what was to be his last moments.
That was difficult because the father-in-law had passed, and then he just did not do very well, and that was, we had gotten so attached to him, mostly because, again, us being family for him. I held his hand and I said, we're gonna get him through this, and we're not going to have him be a statistic. And
moments like that are very hard. They're very heartwarming. But I have learned that after a lot of heartbreak with these COVID patients, unfortunately, I cannot become emotionally attached to them anymore. You are connected to these patients. You do become their families. And when they pass away, you are losing a part of yourself. There's no way to explain the heartbreak that we feel.
Donna. Hey there.
So much.
Yeah, absolutely. Thank you. Is it awesome out here?
No, we're out in the sticks.
Yeah, Carson. Hey, Carson. Good to see you. Hey, Jim. Hey, good to see you. We talk about you guys and think about you and Keith and Mr. Means truly every day. And
well, you know, every time I come by the hospital and I see the floor, I mean, I'm always saying a prayer for y'all.
We appreciate it. We do.
Because I know you've needed it.
Keith's room is every day when I walk in, his is the first room that we walk by, and literally every single time I walk by, I think about him, and there's not a day that goes by up there that the staff doesn't talk about him or ask about him, and you and your family, and you guys have touched us in those prayers. They get us through some days and many days, and you guys are.
We send out a lot of prayers for y'all.
It was tough for us because all of us grew to love them. We really did, and we appreciate it more than y'all could know.
Right after it happened, like all these patients.
Caring for Keith and Mr. Means has definitely changed me, and you know, I think that was the hard, you know, the hardest call I've probably ever had to make. Because you know, every day, you know, talking with him in the beginning before we ever started, we talked about where we were trying to go, and we felt like we had gotten, you know.
So anyhow, we tried to decide what we were going to do, and so we decided to make a memory garden for him, and then I found this angel, which I thought was most appropriate.
Absolutely.
For Keith.
It just seemed cruel to have to call and tell Donna. At that point, you know, Keith was like a family member, and even more so even Donna, because of the conversations we'd have every day, and I just felt like it was so unfair. You feel like you let him down and let his family down, because he fought so hard and they were there with him, and it's like losing a family member. It really was.
Although I am grieving, and although my coworkers are grieving and my physicians are grieving, we look at Donna as an inspiration, because Donna is a pivotal pillar in our unit. It's gonna be a great day. We think about Donna often and her strength. Genuinely, if Donna can make this, we can do it. Those were our patients that we had, our first patients that we had for a very long time, and you know, Donna has become our family.
This whole experience has truly made our team much stronger. Like I said, it was a brand new unit, and nobody could have been prepared for anything like what we were getting into.
You too, get some rest, drive safe, okay? Yep.
When you have a certain patient like that and a family like that, you know, it brought us together, and it helped set a foundation for our group as we took on this pandemic.
The fact that nobody's left, the same people that are there in the beginning, shows the impact that this has had on everybody. It sounds cliche, but they're there to take care of the person, not the patient. You ready? Strong work, team. That's what I took from him when I knew him, and the stories from Donna and Carson, and to enjoy what you're living and not take any time for granted. That wasn't really a medical lesson, it was just a life lesson.
story just shows that, one family of many that have been affected, that became part of family, and that we still communicate with, still think about, and still pray for. We are all in this together, and we will get through this.
They look beautiful.
Dr. Joy. Another one of those awesome hugs. When I came up here to see Keith, that you gave me a hug, and it was the first hug I had in 2 weeks, and it just meant so much to me. But I wanted to give you guys something. I had texted Dr. Keith a while back this message. It's called Malachi's message. Oh. This is it, and it has a picture of Keith on here with his room number and the dates that he was here. And I just, I hope this provides a source of comfort and strength for you when you're having a hard day. And just know that, he's up there looking down over all of y'all. And we're praying for you too. Okay? He was a
Look
cute
at
little
he's got
baby.
such big eyes. So cute.
Yeah.
All I have now is the memories that have happened in the past to think about and kind of relive. So it's just so important to just stop and just to be appreciative for the time you have with people. Spend time with them now, not tomorrow, not this weekend. One thing that's just completely rocked my world and changed it is, losing my grandpa, and then losing my dad 2 weeks later. Someone who I thought I was going to have a lot more experiences with, who, I was going to go trout fish with, who I was going to go hike with, His passing has definitely made me appreciate all those times that I had like that with him. It's something I miss greatly because I just thought I had so much more of it.
I have reached out and spoken to somebody who lost her husband a couple of months after I lost mine. And I feel like if I can be a source of comfort to anybody who's going through the same thing that I've been through, I think it's important for me to help them.
A little bit more to me, Keith. There you go. Thanks. All right.
It's the end of the world at the palm of my hand. When it all goes to hell, will you still be my friend?
Count three. 1, 2, 3.
My face to the sea and my back to the land. If you can't come with me, I'll understand.